I think the big message is be prepared. Learn Stop the Bleed by going to stopthebleed.org/summer in preparation of summer season. But bleeding injuries are the number one cause of preventable death after an injury. So if you can prevent that bleeding from getting worse or stop the bleed, you can save a life. You can do it for free. You can go online and train, and you can get the materials easily.
How quickly can somebody bleed out? How much time are we talking about? What's the urgency here?
You're talking about minutes. When somebody has a serious bleeding area, a serious injury that's bleeding, you can bleed your entire blood volume in minutes. And we know that the earlier you treat someone for that bleeding and prevent that bleeding from happening, the more likely they are to survive.
Hey everyone, this is Jonathan Marx from GoToHealth. I hope you're having a great day. You know, summer's coming, and experts urge that everyone prepare for unexpected medical emergencies, as injuries tend to surge during the warmer months. Why? Because we're outside doing our favorite things and lots of activities. Often referred to as trauma season, summer spikes emergency room visits nationwide as people, especially children, spend more time outdoors. Bleeding emergencies can happen anytime, anywhere, and to anyone. Did you know that a person can bleed to death within minutes after a serious injury if not treated immediately, according to the American College of Surgeons? Uncontrolled bleeding is a leading cause of preventable death, and quick intervention using bleeding control techniques can make a difference before first responders arrive. We're going to teach you about some of these bleeding control techniques in this upcoming interview. While accidents can't always be avoided, preparation can improve outcomes. We're talking today with David S. Shapiro, MD. He's a surgeon, trauma provider, and critical care physician with 20 years experience in hospitals and community-based trauma care and leadership. He's the chair of the American College of Surgeons Committee on Trauma and their Stop the Bleed program. And if you want to learn more, you can go to stopthebleed.org/summer. So welcome to the show, Dr. David Shapiro. How are you today?
I'm good, Jonathan. Thank you for having me.
Good, my pleasure. So let me ask, why does the risk of injury increase during the summer months?
This is the time of year where we're all going outside finally. The weather's better, we're doing things, we're going on vacation, we're even going to work for shorter times and doing other things. So we're all exposed to the things like bicycling, boating, camping, hiking, just being outside. Even when we grill and we have a knife in a place that we're not used to having, all those things put us at risk for an increased level of injury.
Got it. So let's talk about what is a bleeding emergency. I mean, if I fall off my bike, as you mentioned, and get scratched or whatever, I mean, when does it become a bleeding emergency?
Well, bleeding can be a variety of problems for people. And some people who have diseases of certain kinds can result in having severe bleeding from anything. But when everyone who's out there has a risk, it's the bleeding that comes from falling off a bicycle and landing on something, or having a large laceration that results in a large amount of bleeding. How do you know it's large? It's whether the bleeding is spurting or pooling or staining clothes. If you see that sort of stuff when you approach someone and you see somebody fall and you can see staining, spurting, pooling of blood, you know something is more severe. So that's how to really recognize it.
Good. So if I see that, a friend, a family, a stranger, what are some life-saving steps that I can take to help in a bleeding emergency?
Well, if there's an emergency before you, the first thing to do is calling 911. We want to make sure that help is on the way. Second, and the 3 steps for Stop the Bleed are applying direct pressure, packing an open wound, and putting on a tourniquet. We can talk about those in more detail, but pressure is just holding pressure on something until help arrives. Packing means using a piece of cloth or gauze and putting it almost like a handkerchief in a pocket, and stuffing it in there and holding pressure on that. And then lastly, if it's on an extremity, we use a tourniquet as a third option to help quell bleeding in an extremity like an arm or a leg.
What does packing do? I mean, I could just put my hand on something, but if I have a piece of cloth under there, aside from catching the blood and my hands not getting as dirty as they would be, what does packing do?
Well, packing fills a space. So if you can imagine, if someone has a large gaping wound, and these are things that we do see, and you fill that space with something that's not blood, you're going to decrease the amount of blood that's there. If you're just holding pressure on the outside, it may not stop that internal bleeding until that space fills up. So we really want to fill that space, pack it tightly, and then hold pressure.
Got it. Thank you for that. So, can you share with us one or two real life stories where bleeding control really saved a life?
Definitely. I've seen this in a variety of places around the country, around the world. I went to a rodeo not too long ago, a couple of years ago, that I was a medical provider during, and I saw someone who was injured actually in the stands. They had
Mm,
fallen off and tore their arm open on a wooden bleacher.
mm.
And that wound was gushing blood. There was a lot of pooling and squirting of blood. And a bystander, before I even arrived, had already gotten pressure on it. He was getting out a tourniquet, and his wife was helping him apply the tourniquet to that person. By the time I was on scene, really right in front of them, they had already applied the tourniquet. They had direct pressure on. 911 was called, and everything was calm. Even the person who had fallen was relaxed and calm and talking.
Mm.
This is when something can happen right immediately after the injury occurs that helps prevent all the bleeding from happening.
Got
When
it.
somebody comes to the hospital after they've been injured, they have the entire time from the injury to the hospital arrival to bleed. When EMS arrives, they can provide similar treatments to and stop bleeding. But in that period between injury and EMS, you become the provider, you become the practitioner that can help stop bleeding.
Got it. Do I need training to do this?
We prefer that you have training because there are certain techniques that we want folks to learn. And just like CPR, you can do the course in a variety of ways. The great part about Stop the Bleed, though, is that it's free. It doesn't cost people anything. And folks can go to our website at stopthebleed.org/summer and either do interactive classes online. They can find a course nearby, or they can request a course come to them by local providers. We have a network of about 250,000 instructors around the world, a variety of experiences in different lines of work who can teach. And if we can find one near you, we'll help you get a course. The course online is interactive, but it's not hands-on. When you're in the presence of an instructor, they can teach you how to use the tourniquets, teach you how to use, for instance, a rag as the gauze instead, or how to cut clothing up into the right pieces. But if we can do all those things for you, you can get the training anytime, anywhere. And it really works for all ages.
So, if I belong to an organization and I'm interested in bringing training there, how many people do I need in order to get an instructor to come out?
So honestly, you need one. As long as one person
Really?
is interested, we'll have a course arrange or help you arrange a course. What you'll find is that as soon as you want to have a course and people start finding out about it, they're going to sign up as well. People who are EMS, nurses, physicians, PAs, people in medical careers,
Mhm.
people who do, for instance, law enforcement, fire departments, they can all become instructors. And if someone isn't an instructor, but they want to become one, they can do that as well. I think the important takeaway there is if somebody wants a class, they go to the website at stopthebleed.org/summer. They click on the find a course and they can make a request there. And then we can help them at the American College of Surgeons find someone nearby who's teaching already or who can make themselves available to them.
Good, fabulous. So, tell me, there's a Stop the Bleed kit. What is inside that?
Stop the Bleed kits they're little prepackaged kits of materials. It's like a very advanced first aid kit, but for a very particular reason. First thing in that kit's going to be, it's a little pouch, and sometimes it comes in a plastic bag. I have one sitting next to me just by happenstance, and I opened it. It
Okay.
has a pair of gloves that are tightly contained. It has a bit of gauze, and the gauze can be like a big package or a small package, but it's compressed gauze that you then pull apart. And again, you don't need gauze. You can use a piece of t-shirt or rag as well. Doesn't matter if it's dirty. Then we have a pair of scissors that are used to cut the gauze or cut clothing away. And we have a magic marker to mark down times and things. And we have a tourniquet. So really, it's the gauze and the tourniquet that make the most difference. Most kits also contain a small instruction manual that teaches people how to do the stop the bleed technique, but the class is very important to learn the technique. These kits are also available on the website, and having one in your car, camper, saddlebag of your motorcycle, backpack of your camping trip, one person in your group can have one and save a life. We encourage folks to have them in their homes. I have one in my house in the basement, the garage, and in the kitchen. I also have one in my mini library outside because my neighbors all learned Stop the Bleed one day a couple years ago from me, and I
That's
want them
great.
to be prepared to have access to materials.
Good. You mentioned before that you could use a rag. I mean, doesn't a dirty rag or just any piece of clothing, doesn't that introduce potential bacterial infection?
It can, but quite honestly, if someone is bleeding to death, they don't have time to get a bacterial infection. They're going to die before it happens. So I've told people, if it's a sock that's been sitting in the middle of your garage covered in grease for the last couple of years, use it. If that's all you
Wow.
have, use it. But this is why we have kits, so you can have something clean around. This is just one of those neck gaiters you wear in the winter, and I keep it in my kit because I can use it to wrap up the materials as well and keep
Good.
them all contained.
Good. So, Doctor, are there any questions that I didn't ask that I should have, or is there a big message you'd like to leave with people today?
I think the big message is be prepared. Learn Stop the Bleed by going to stopthebleed.org/summer in preparation of summer season. But bleeding injuries are the number one cause of preventable death after an injury. So if you can prevent that bleeding from getting worse or stop the bleed, you can save a life. You can do it for free. You can go online and train, and you can get the materials easily.
That's
Help your
great.
families, help the community.
Good. Let me ask one more question. How quickly can somebody bleed out? How much time are we talking about? What's the urgency here?
You're talking about minutes. When somebody has a serious bleeding area, serious injury that's bleeding, you can bleed your entire blood volume in minutes. And we know that the earlier you treat someone for that bleeding and prevent that bleeding from happening, the more likely they are to survive.
Good. Thank you. Thank you so much for being on the show today. It really helps us be safe with our neighbors and our families and our loved ones. We've been talking with David S. Shapiro, MD. He's a surgeon, trauma provider, and critical care physician with over 20 years of experience in hospital and community-based trauma care and leadership. He's the chair of the American College of Surgeons Committee on Trauma and their Stop the Bleed program. And again, you can learn more at stopthebleed.org/summer. Thanks so much for being with us today, Doctor.
Thanks for help spreading the word, Jonathan. Appreciate it.
Good. So this has been Jonathan Marx. Remember, you can subscribe to us at our website, GoToHealthMedia.com, or you can subscribe to us as well at YouTube or any of our podcast networks, Apple, Spotify. And if you like what we're doing, we're really getting the word out about evidence-based medicine. Please leave us a thumbs up or a 5-star review. That helps us get the word out to more people. Thanks again. This has been Jonathan Marx with GoToHealth. And as we say at the end of every show, Go to Health. God bless. We'll see you again next time. Bye-bye. Thank you for tuning in today to Go to Health. You are one of almost 10,000 people per day who enjoy the evidence-based health information offered by our guest health experts. You can watch us on our website and YouTube and listen to us on 8 podcast networks. Be sure to join Jonathan Marx in our upcoming shows each week. If you like our show, please share this episode with your friends and colleagues. You can subscribe to the show, join our email list, send us feedback, browse through the online store, and view our library of over 150 shows at GoToHealthMedia.com. See you next time, and remember to elevate your life with Go to Health.